Landmark 2014 law and the legislation that we're taking up this week may be some of the most significant bills that I think that my colleagues and I here today will work on in all of our tenure here at the State House. The prior bill that we did, I think, taught me how difficult it can be to forge consensus on addiction issues. While everyone can agree on the weight of the issue, we sometimes lose sight of the diversity of groups that need to come together if we're going to effectively battle this public health epidemic. And with that, I'd like to thank all of the organizations and advocacy groups here as well. Thank you so much for coming. That's why I'm especially proud of the work that these committees have done in putting together this plan. We have made great strides, I think, but our battle remains. I look back a few months ago, and I can tell you a very interesting story. I was feeling somewhat optimistic on a particular day, the day of the fentanyl bill signing, as a matter of fact. On that day, I also attended an event wherein Devin McCourty of the Patriots was speaking to some young athletes, telling them of the concerns that he had about them and that they should be concerned about whenever they get injured in a sporting event, to be careful in terms of the pills that they may be taking. While sitting there listening to Devin McCourty, I received a text from a man telling me that in my hometown of Winthrop, that a young boy about my son's age, 31, 32, had died from an overdose that particular morning. I can tell you in my district, we have lost countless friends and neighbors to this devastating disease. And I want to sincerely thank the folks from CASA and Winthrop and Revere Cares as well for your work, and most important work that you do. And I'm sure that it happens I am sure that it happens in districts all across this Commonwealth. I can tell you no matter where I may be, whether it's rural or urban, and no matter the group I'm talking to, what consistently comes up before me at some point, either during my remarks or questions or at the end, is that someone always has a story how about in their particular city or town, someone was lost to substance abuse. We are in the midst of a public health crisis. The opioid epidemic drains vitality from our cities and towns, extinguishes lives and steals souls. But by bringing the light of this legislation, we can defeat this scourge. Our 2014 and 2016 bills are medically comprehensive and emphasize collaboration between providers, educators, insurers, and advocates. Our landmark 2014 law was designed as a foundation which will now complement this legislation. In 2014, for the first time, we made sure that people get 14 days of coverage. This week, we will build upon that law to pave a path for the recovery of thousands of our loved ones. Because we know that voluntary treatment is the most effective course of treatment, hospitals will conduct a medical evaluation when individuals present themselves with an overdose. Patients will then be given medical advice and treatment recommendations. With our 2014 law in place, patients receiving these recommendations will then be empowered to take the crucial step from the emergency ward to stabilization and then on to transitional services. The 2016 bill also transforms the state's prescription practices, focuses on dual diagnoses, and improves training and education, among other things. I now am going to have three of my colleagues that are going to speak in more particular detail on the legislation, which will be debated, by the way, this Wednesday before the House. It's my pleasure to introduce one of the primary movers of this legislation, Chair Lady Liz Malia. Madam Chair.
Thank you, everyone. First of all, I want to say thanks to a number of people, but particularly Speaker DeLeo, whose leadership and continued efforts to change how we view and treat those suffering from addiction have led the way and have opened the doors for this discussion and hopefully for many solutions. Chairman Dempsey and Chairman Sanchez collaborated and shared commitment to curbing this public health crisis. I want to thank them both very much. Our stakeholders specifically offered their unique perspectives on combating the opiate crisis, including the Mass Organization of Addiction and Recovery, many of us know you as MORE, the Gavin Foundation, the Association of Behavioral Health, the Mass Association of Behavioral Health Services, the American Cancer Society, the Mass Pain Initiative, Mass Association of Community Hospitals, Mass Hospital Association, Mass Medical Society, Mass Association of Health Plans, Blue Cross Blue Shield, and Beacon Health Options. This has really, truly been a collective effort. Last session, the Speaker alluded to the legislation we passed, Chapter 258, that required insurance coverage for up to 14 days for detox and step-down services. Part of this awareness that in the work that we're doing, we have to keep remembering is incremental. We have to start with what we can work with and build for the future. Our goal with this legislation is to create a safety net, a new standard in acute care settings, a new best practice designed to ensure the proper assessment and discharge of patients who seek voluntary treatment. And I am confident that our plan is a balanced, pragmatic approach to addressing patient care and ensures that our most vulnerable population has the access to treatment they need. Those of us who have lived experience with substance abuse, some of us are in recovery, some of us have lost family members, loved ones, our friends, co-workers to this disease. We understand how crucial this battle is. And I think we also understand this is only the beginning. One of the most difficult questions to answer that has come up in a lot of the meetings that we've had has been, when will we start seeing things turn around? We can't answer that. We heard last week of the loss of lives out in Holyoke. Those problems will continue to happen. Our job is to make sure we have a way to treat the people who are trying to access treatment, and then to begin doing the education and the outreach to stem the demand for these drugs. I'm going to introduce my colleague, Chairman Sanchez, to make a few comments. Excuse me.
Thank you. Thank you, Madam Chair. Thank you, Madam Chair, and thank you, Mr. Speaker, for your leadership on this issue. This opioid crisis has hit so many. And, Mr. Speaker, this isn't just this one bill. This is Chapter 257. This is every budget that we've taken up and the supplemental budgets that we've taken up alongside with our Chairman of Ways and Means, Brian Dempsey, to make sure that we attack this where it needs to be attacked at. And not only that, to be able to take advantage of those folks that are best able to get to folks when they're at their lowest low. And for those who saw the documentary that was showed at the Revere a number of weeks ago, those folks are at their lowest low and then fall through the trap door at that lowest low. With the hard work that Chairwoman Liz Malia has put, which, make no mistake about it, this has been a lifelong job for her as well. She's been working on issues of opioid and substance abuse ever since ever since she was an aide in the building, ever since she was a social worker. She's devoted her life to these issues. And to have her at the helm, working with all of us on this, again, we all feel honored of all the work that you've done throughout your life, Liz. We have so many members of the House that are here, and we'll go down the line because I know I'm missing a few heads. So shout out if you're here, your name. Okay.
Representative Kay Khan.
Representative Paul Donato.
Alan Special.
John Ian Ryan. Byron Russian.
Ellen Story. Carolyn Dykema.
Dan Cullinan.
Sarah Peak.
Carol Fiola.
Evangel Cavallo.
Nick Collins, Jay Livingstone.
Kate Hogan.
Mike Finn, he's out there. Also, Representative Mike Moran is out there too, and I'm going to probably miss one or two folks that are here. Oh, and of course, the dean of the House, our friend Representative Angela Scotia, who has also devoted many a year and many a dark hair, because when he started working on these issues, there were a number of us that were still in diapers. So thank you for all. Just in terms of the issue itself, the facts. This month in Health Affairs, it found that people with substance abuse disorders are 2.2 times more likely to be hospitalized than those folks who are abstaining from illicit substances. And we know that where do they end up? They end up in hospitals. And hospitals are high-cost sites of care. This costs our health system an unnecessary amount of money, but also doesn't necessarily get at where people need to be taken care of in terms of the long term. Because one thing that we do know about this epidemic is that it is a long-term disease. And we know that only 13% of the people in Massachusetts with substance abuse disorder receive that treatment that could be helping them from relapsing and returning to the hospital. So we need to make sure that we identify patients in the ED, evaluate them, and get them to the appropriate treatment so that we can continue towards another step in improving everyone's health outcomes here in the Commonwealth and living up to our ideals in that area. Here in Massachusetts, 4.6 million prescriptions for controlled substances were written in Massachusetts. That's over 240 million pills. That's enough for every man, woman, and child to have a 30-day prescription. This is unnecessary. And the changes that this bill provides, we're going to be able to say we're moving forward to take another measure to stem the tide of opioid abuse. Again, thank you for all the work that you've done, the members, and also everyone that's here to support us on this incredible initiative. Everyone here has crisscrossed the state at any given time, and this is what we've heard. How do we stem it, and how do we stem the tide where people are at? So thank you for your commitment again, Mr. Speaker, Mr. Chairman, Madam Chair. Thank you for your hard work, and members. And also another advocate and hard worker on the issue, a great friend of ours, Sheriff Steve Tompkins, who's also crisscrossed the Commonwealth, talking about, what is it, 40% of the population being locked up in his facilities. A little bit higher. Well, the statistics are pretty high, but thank you for being with us. Also, someone who's not here that's also been a big worker with us too, Representative Ron Mariano, who's somewhere around here. But again, thank you. And I have the honor and pleasure of introducing a man who's worked so hard with us, a man who every budget season gets to sit down with all 160 of us, and then all 10,000 of you. But he does it with such, again, with an open door and a big heart, and that's our chairman of Ways and Means, Brian Dempsey. Thank you.
Thank you very much, Jeff. And I want to acknowledge, again, the Speaker's great leadership on this issue, not only with respect to the proposal that the members will take up for consideration on Wednesday, but throughout his tenure, leading the effort with respect to this heartbreaking epidemic that we are in. Certainly the leadership of Liz Malia as an outstanding chair and someone who has committed her life's work to this. We can't acknowledge Liz enough for her efforts, again, not only here, but throughout the last many, many years. I won't get into specific years, Liz, many, many years. And Jeff Sanchez, who's been a great leader on this issue as well. And thank you all for your efforts. And I think it's important to maybe touch on a couple of points. When you look at where we go and how we approach this issue, it really comes down to two categories. Jeff touched on it. One is funding, and one is the budget. And it's startling when you look at the numbers, because when you go back and look at fiscal year 2012, we were committing $83 million to a number of areas with respect to substance abuse here in the Commonwealth. That figure today is $138 million. I wish we didn't have to spend all that money, because we're doing it to do our very best to help individuals deal with this addiction. But we have increased funding by 65% since FY12, and we've got to continue to do more. And it's also policy. The Speaker, Liz, and Jeff have touched on many of the things that we have done, prior authorization being the most recent, and I think very, very significant. Something we passed in July, went into effect in October. We believe will have a very important impact on the citizens of the Commonwealth. So today we build on the efforts that we have made over the last several years. And I was asked to just share with you some of the highlights of the bill. The first thing we do is a mandated substance abuse evaluation. We think it's important that any individual who arrives in an emergency room here in the Commonwealth and is showing signs of opiate use, overdosing, that within 24 hours prior to the discharge, that individual is provided with options, provided with community resources, that there is a specific discharge plan that has to occur prior to the release of that individual. We think it's critical. We think it's critical for a number of reasons, but I think the most important is that we know that the first 24 hours is the most important period of time with respect to getting someone into treatment. We believe that this will go a long way to getting more folks, acknowledging the resources, and making sure that we're providing them with some pathway for treatment. The second is with respect to the number of days relative to prescription for a first-time opiate prescription. We looked at Governor Baker's proposal, Lieutenant Governor Polito's proposal, and we certainly applaud their work on this. We felt that it was important to, practically speaking, provide an ample number of days for somebody who, again, has dealt with serious pain injury, that recognizing that that individual has to physically go back to get a new prescription. We believe that a 7-day period of time, limiting that prescription to 7 days, deals with the issue of making sure that there is a proper pain assessment with respect to a renewal of the prescription, but also make sure that we're doing it in a way that is practical for both the patient as well as the medical community. We also propose a 7-day limit on all prescriptions for minors, something that we think is important with respect to recent developments with respect to FDA approvals. We think that the issue relative to minors is something we ought to speak to in this legislation. The issue of prescription monitoring and the prescription monitoring program, something that, again, Liz, Jeff, the Speaker, so many have worked on over the last several years, is very, very important. We propose that with respect to those prescriptions that are the high-risk opiate drugs, that those prescriptions ought to be checked every time that they are proposed to be refilled. We believe that that will amount to a number of somewhere around 12 or 15 particular drugs that will, in which that PMP review will occur. But we think that's, again, essential to, again, monitoring the number of prescriptions. One of the issues that the Speaker wanted to prioritize in this bill is the issue of education. Now, as we continue to increase funding and to change policy, we know that the most obvious issue for all of us is the issue of education and prevention. And when you talk to district attorneys around the Commonwealth, what they tell you today is it's much more than just showing up in a high school class and talking at that level. You really need to go down to third grade, fourth grade, fifth grade, and begin to teach our children the dangers of drug addiction, the dangers of drug use. And the Speaker wanted to make this really a centerpiece of the bill. And we require all schools to have a substance abuse policy in place. We believe that it's important that the Commonwealth have, again, a universal approach to this in every single town in the Commonwealth. With that, I want to thank all of those who have joined with us today, all the stakeholders that have worked with us. We believe that this is, again, another effort building upon the work of the past, continuing to do all that we can, working together. Thank you very much.
Maybe if all of you could introduce yourselves, I want to make sure I don't forget anyone. You I know, Mr. Walsh.
Steve Walsh, Mass Council of Community Hospitals.
I'm Mike Aljo from Blue Cross Blue Shield of Massachusetts.
David Maniotto from the Mass Association of Behavioral Health Systems.
Mary Ann Frangulis with MORE, Massachusetts Organization for Addiction Recovery. Cindy Steinberg with the Massachusetts Pain Initiative.
Dennis Dimitri, President of the Massachusetts Medical Society.
Mark Clements, American Cancer Society Cancer Action Network.
John Irwin with the Conference of Boston Teaching Hospitals.
Laura Pellegrini, Massachusetts Association of Health Plans.
Victor Rabia from the Association for Behavioral Health Care.
Lynn Nicholas, MHA, Mass Hospital Association.
John McGann, Galvin Foundation, Recovery Home Collaborative.
Thank you very much for coming. All right, I don't have any questions. Thank you all very, very much.
Stephen, after the standard evaluation is performed, how does this bill ensure that addicts who show up in the emergency room don't bring into society and use that?
How do we, does it help?
How does this bill make sure that when addicts show up in the emergency room after this evaluation is performed, preventing them from entering the streets and reusing?
Well, what this bill provides is that at the conclusion of their initial evaluation, that this takes it a step further than we've ever taken anything before in terms of making sure, that their next appointment with the proper physician or psychiatrist or whoever it may be, counselor, I should say, is probably the best, all the way up to a transition house before they would leave, having combating, hopefully, this addiction. So this, unlike other things that we have done before, sets forth a plan, if you will, that's initially discussed and initially set forth in that visit at the emergency ward. That hopefully is going to be the key to the whole thing.
Why do you thought Governor Baker's proposal for the 3-day voluntary?
The governor's proposal, I think, first of all, I need to congratulate the governor. The governor has been a primary force relative to fighting opioid abuse in this Commonwealth from day one since he became governor. And I also look forward to working on this with our colleagues in the Senate. I think we had a number of issues relative to that, and after discussing some of these with some of the folks here, I think what we have here is a little more collaborative, I think, than in any other piece that's before us right now. Collaborative, in a sense that I think it's going to be of the most benefit to the particular client. For instance, I have some concerns that if you hold a person there 3 days against their will, I think there are some issues relative to whether that is constitutional, for instance. The other point I'd like to make is that if you were to visit any of the hospitals, I was going to say major hospital, I'll say any hospital, you will find, as they have stated to me, and I have verified this, that about 1/4 of the beds in these emergency wards are taken up by those with substance and mental health abuse. So if we're talking about keeping these folks in the emergency ward for 3 days, I don't see how a hospital is going to be able to either care for them or, for that matter, care for those who have some other physical ailment that are there in the emergency ward.
Basically, what we're doing is again, as part of a collaborative effort. We've been working with the administration. We've been working with Health and Human Services Secretary Mary Lou Sutters. We've been working with the Department of Mental Health. We've been working with providers, trying to find a way to begin getting the data together so that we can give that information, we can assemble that information so that it's automatically accessible from the emergency room, so that the doctors and the staff that are working with people will be able to give real-time referrals and improve the access period of time that people are getting into real treatment. Right now, it doesn't exist for everyone everywhere. It is, one of the real realities, the cold realities of this opioid epidemic, that we don't necessarily have geographically, we don't have beds available, but there's been a tremendous effort on the part, I know, of the administration and of the providers to begin coordinating all these efforts and making sure that there is a bed for someone who's willing to seek help at that point in time.
The other thing I just wanted to point out was that I think the 2014 bill and this legislation really complement each other very well. And I think one of the other things you have to consider is the fact that, as Chairman Dempsey had mentioned, we increased funding by some 65% since that time. And part of that funding is going for the increase in beds, increase in counseling. And the 2014 law set forth, now made it mandatory that coverage would have to exist, for 14 days. So I'd have to say between those two bills complementing each other, I think we've found a relatively good solution to the problem that we're facing right now. The other thing, one other final point on that. It's interesting. I was speaking out in Greenfield to a Chamber of Commerce. And after, when the questions and answers came up, we were thanked as a legislature and thanked the administration as well for the fact, for the first time in their history, they had a facility that addressed the issue of substance abuse. They had some 18 beds or so, which they never had before in that particular part of the Commonwealth. And I think that goes right to the heart in terms of how seriously all of us are taking this issue and how seriously we're all looking to combat substance abuse. Mr. Chairman?
You were saying how the costs associated with dealing with the opioid crisis has gone from $8 million to 30 million, 65%. Are there additional costs included in this bill, or that we go beyond that?
The last supplemental budget that was passed included $27 million in additional funds that continue to go towards those areas that we need to continue to increase our resources, whether it be beds, whether it be rate adjustments, Narcan, all of the things that we've all talked about. We continue to increase funding. So that brings the total to $138 million.
But this bill itself?
This bill does not include, when the governor filed legislation, he also filed $27 million as part of the supplemental budget at that time. We dealt with the funding issue first, and Wednesday, of course, we'll deal with this matter.
This is policy along with the funding.
Correct. And again, that's why we wanted to mention both, because again, both are important. But I think it's not just about money. It's also about policy and the changes that we can embrace, and they both are important.
Correct.
So technically, after the evaluation, we go up to emergency rooms would be free to enter.
One of the things we have learned very readily upon talking to folks and upon reading about it ourselves was the fact that a person who enters into getting help voluntarily, their chances are staying for that help and for not leaving any of the institutions they may have to go to are a lot better. So we feel that a voluntary commitment, shall we say, as opposed to an involuntary commitment, works a lot better in terms of taking care of the needs of those with substance abuse.
Chairman Romano, can you speak at all to how closely the Senate was involved in the development of this bill in your committee and how easy or difficult negotiations will be, considering that they've already acted on a number of similar provisions
Right.
and took a different approach than you're taking here?
I think what's important to notice is that there's been an incredible amount of collaboration. Both houses have different resources and have a different viewpoint on which aspects of this crisis need to be addressed first. We're talking to each other all the time. Our staffs are talking all the time. Again, as we're talking with and connecting with the administration, there are a lot of good ideas out there. We have to try to distill the best out of the three different proposals that have come forward, ours, the governor's, and the Senate, and basically operationalize how we move forward at this point in time.
Assuming you could see yourself down the line adopting some of the Senate's ideas, like the expert screenings in high schools, or?
Absolutely. The discussion on all those issues is going to be part of the debate. It's going to be part of the backroom conversations. It's also going to be part of, I'm presuming, and I don't know if I'm stepping out of line, but it will be part of some of the work we'll do in the budget this year. Because again, some of the needs out there are extraordinarily difficult to meet. And again, how do we provide expert or intervention policies in the schools is going to be something that's going to require the schools, the Department of Education and all of the agencies of the state to work together in partnership.
We'll do one last question, and then staff can be available on background if there's any technical questions.
Any guess on how quickly you can get a bill to the Department of Justice? Any kind of timeframe on that?
First of all, we have to pass this on Wednesday. Secondly, I think we'll go into, we'll be going into conference with the Senate. I think what's a little bit different about this, and there's going to be, obviously, there are some variances. The good part about this legislation is the fact that the governor, the Senate, and the House all agreed that something should be done. So I think there's really a strong will to see that something is done and something is done this year. Having said that, I think that there are so many moving parts to both pieces of legislation. I think, it may take some time, but again, I really feel that there's a real strong willingness to try to get something done and try to get something done as soon as possible.
Thank you. Thanks, everyone. Thank you.
One other thing, if we could all just have a moment of silence for all those that we have lost to substance abuse in our Commonwealth. Thank you.
Thank you. Thank you so much.